Hello, everybody. Eric with American Business Systems, and want to welcome you here to our Wednesday webinar. Now, let me introduce you to the one that's going to introduce you and do the interview with Rene, and that's Patrick Phillips. He is the founder and the CEO of American Business Systems. He and his wife actually started this business over 25 years ago, but actually started selling it as a business opportunity about 25 years ago. He is also the chairman of the board of MERMA. Now, MERMA stands for Medical Revenue Management Association of America. They are the ones that actually give out the certification of a certified medical revenue manager at the end of our training workshop. And again, there's the Billing and Coding Advantage magazine, which again, Patrick is a member of the editorial board, which again, reminds you to go back over there to the handout and download that PDF over there. So without any further ado, I'm going to ask Patrick to come on in here, and I'll let him finish up here, and I'll see you at the end of the webinar. Patrick, it's all yours, sir.
Thank you, Eric. I appreciate that. I just want to point out that article that you can download there in the handouts, I did not write that. That was just an article that we thought another writer had written, and I thought it was a good resource because he explains why doctors need to outsource their billing. So there you go. All right. By the way, I'm also an author. You can go out to Amazon.com and find these 3 books, and we're writing another one right now behind the scenes. So I can't tell you about it. I could, but I'd have to kill everybody because, you know, then I get all these questions about it in our support department. But you'll see soon that there's another book. We developed these books primarily for our licensees and for use as a marketing tool. We'll talk more about that new thriving medical practice here in just a moment. Well, let's get our guest on the line here. Rene, are you still back there with us somewhere in the background?
Yeah, hi, I'm here.
Oh, okay. Wonderful. Now, we can't see you yet, but I don't know if you've got a webcam button there you can push to come on live or not. There we go.
Hi, everyone.
Can you hear me? And I put that picture you gave me, what, about 9 years ago there on the screen. You've lost weight since then. That's good. You're looking younger. Probably because you look like you're a businessman there in that suit there.
I know, right? It's very serious.
Yeah. That picture of me is probably 10 years old too, so I don't know. We just always use pictures of us when we were younger. Well, Rene, thank you so much for taking time. I know you are a busy guy. You were just telling me before we got the webinar kicked off here about, you know, how you've branched out into other things. But let's step back in time when you first learned about this business and why you selected, you know, medical billing, medical revenue management as a business. Tell us about the story about how you ran across us.
Yeah, you know, it's been quite some time. It's been, I think, 8 years now, but in my mind, it doesn't feel like it's been that long. I was working overseas and I wanted to come back to the US and have my own business because I had, you know, gathered up a little bit of money and I thought that what's the best business to be in, especially that when I had graduated, it was in the middle of the financial collapse, you know, back in 2008, and I was very focused on something that would be recession proof. So you know, my family hasn't been in healthcare per se. You know, my grandfather, one grandfather of mine was a doctor, but then it wasn't very much a family that was focused on healthcare. Basically, you know, a lot of other families that I got to encounter throughout the years, you'll see that, you know, the sons, the cousins, the daughters, everyone is a doctor, or like they do something in healthcare. But when I started looking into healthcare, I knew that that was the field for me. And my main background is finance and marketing, and I just wanted to get into healthcare, but at the same time into the management and finance roles. So the best way to me was, you know, if I was able to handle the money, the finances, how to make, an optimum medical clinic run. That to me was very interesting, especially that I was reading everywhere that there's a lot of confusion with the EMRs. They just started rolling them in. A lot of doctors are closing down their practices because their billing is all messed up. So that's when I really got reeled into this field. And, like everyone out there in the modern world, doing research means, going to Google. You're not going to go to the public library. That's not going to be your first instinct when you do research. So ABS was one of the companies that was the most accredited and viewed, and I just started looking through those videos. It was those very nice, beautiful videos, nice, relaxing music, and they had a very was actually Patrick, your voice. You were the one narrating, and it just drew me in, and I felt that if I want to start a business where I felt like when I felt good listening to those videos, I wanted someone to back me up, because that was some of the things that I was lacking at the time. I needed a good marketer, like a good strategy to market my business, because you're starting fresh, brand new. So that's the most important thing, So I was thinking, if ABS was able to persuade me to join forces and align with their business proposition, then I'm pretty sure they're going to share that same secret so that I can replicate it with my own clients. So that was the big draw for me.
Yeah, so you just basically found us out on some of the websites that we are out on, franchise sites and that kind of thing, huh?
Right. Sometimes you and I think most people go through this. There's always the phase where you're skeptical, because sometimes it sounds too good to be true. But then the more I did research, the more I looked into the different parts of the company. I started talking to different people in the company. Everything seemed very real. So it was very impressive also to go on site in Texas and meet all those people, very like-minded individuals, people that you want to learn and absorb as much as you can from them. It quickly, that illusion that this might be like not what it's advertised, that went away very quickly for me.
Yeah, there are a lot of scams out there on the internet, that's for sure, especially
right.
in the business opportunity franchise world, because everybody wants your money, right? I mean, everybody wants you to join them and buy their training, their package, and so forth. But for 25 years, all we've done is just educate people through webinars like this. We tell them all the information we can about the business so that they can make a wise decision. Because it's not for everybody. It's one of those businesses you have to look at and go, okay, this is something I think it has a future. I think as long as there's human beings and they get sick, that they'll go to the doctor, and the doctor has to get paid, and somebody has to bill somebody for the doctor to get paid.
That's right. Absolutely. And the way how we're going, it doesn't seem like anything is going to become any simpler anytime soon. Everything is becoming more complicated. So the need to have people like us is even more than ever right now.
Exactly. Now I'm going to go open up the question box there, folks. Remember, you're listening to somebody who's actually been here. We're going to go into detail about where he's at with his business and how he got his first client, all those things. But you might have some specific questions that you want to ask to Rene. So just type them in the box. We take them as they come in here, and I'll just read them out loud. All we use is your first name, so we want to identify you. So just ask away, and I'll be watching the question box here as we go. Hey, Rene, I wanted to show a picture here. Let me see if I can put that up on the screen. Does that ring any bells?
Oh, yeah. That's funny. It does. It does. And Well, let me show you something. Here we go.
Oh, there it is. It's hanging on your wall, framed.
Yep, right next to me. Yep.
So,
Yeah,
so
it's
folks,
definitely a nice souvenir.
now this was back in what did you say earlier? 2011, right?
Right, 2011.
Yeah. And but there's Bonnie Preston. She was our instructor at the time that was teaching everybody.
Mhm.
And that's why we do these interviews with people like you, Rene, because people do want to hear from real human beings who they went through the same process that people are going through now, doing their due diligence on us as a company and the industry. And then you actually came down, you went through that week's training and then went out and got started. Tell us about your beginnings, what you did to actually get that first client and how did that work out?
Yeah, it's for me. I was very focused, very serious about this business. So it was not something that I was doing. This might not work. It's not like um, yeah, in my head, I had only one option, and it was to make it work. So uh, I was taking the time to do something which I call prospecting. So 2 days out of the week, I would sit down in front of a computer and I'll do actual research on what are the different primary cares that are in my area. So I'll put certain zip codes. I'll have the map opened up in front of me. And I took the decision to start with primary care because those are the providers that know a lot of specialists. They refer to specialists all day long. So if you get to land a primary care account, first of all, you're going to learn a lot because they encompass a lot of procedures. And the primary care office, basically, if you get to know how to do coding for a primary care office, it's a very good start. Versus if you're coding and billing for a specialist office, it's like the same codes over and over. But either way, I would just do research on all the primary care doctors. I would also do like a Google Maps to see, because sometimes you'll put in that address and then it will be a hospital. So you don't want to target the people that work for hospitals because it's just a waste of time. So any clinic that seems to be that like a private practice, I'll put it in an Excel sheet. Then I will draw a map of I'm gonna go to this practice first, that one. So I'll have a certain agenda of what I'm gonna do. So my thoughts were not scattered. My plan, I had a solid plan. And everywhere I went, I took notes. Of course, I was very nervous at the beginning. But then slowly I shook it off. And anytime I was able to come in for a second time, I would always bring something, either donuts or cookies or something, because now you got you got your chance, right? You don't want to lose it. You just gotta like hang on for dear life. so,
Right.
so I would develop those strategies in my head. So I would be very uh, uh, observant of what people do or react or anything. So I used to be, I came from a corporate world where people would wear suits and ties and looked very professional. And that's how I started when I went to doctors' clinics. I'm introducing myself, that those are the services that we offer, and that's a brochure, and that's my business card. And even though I thought I looked pretty good, but I came off as someone that's probably trying to sell them something. It was probably intimidating. Most people in doctors' offices, they wear clothes that are more baggy, more relaxed, because it's an environment where you're not sitting all the time. You're constantly doing stuff, so you need to be comfortable. And walking in with a suit had some kind of a pushback. So I started wearing different kind of clothes. I even tried out scrubs because sometimes medical assistants, nurses, front desk, they're wearing scrubs. So I just wanted to blend in any way I could, and that's when I started feeling a little bit more of acceptance instead of oh no, we don't want whatever you're selling, thank you. So,
Right.
yeah.
I made that same mistake. Back when my wife and I started this back in the late 80s, I made the same mistake. I dressed up too much and I looked like a salesman walking in the door, So we've learned over the years to teach people that, like you, just put on some scrubs. You can get those at Target, and when you walk in, have a little name tag made up, and you fit in more, and they're much more willing to talk with you because they don't know who you are or what you're connected with at that point. And so I think it's a great idea. You just gave them a great tip there to everybody.
Oh yeah, no, it's a fact. It's a fact. It's
Now you have a question here from well, let's talk about Kazi's question. He says, how many clients do you have now? Can you tell us where you're at now? Here it is, 8 years later.
Yeah, so I'll start from the end so that you understand a little bit. Right now, I kept all the clients that are providers because I also branched out into doing some consultancy work. Sorry, all the providers that are physicians. So providers are split into two groups, physicians and non-physicians. The physicians are the doctors, the MDs and the DOs. And then the non-physicians could be physical therapists, chiropractors, DME, ambulance, helicopter, could be anybody and anyone that's in the medical field.
Anybody that provides medical services of any kind,
right?
Not just doctors.
Absolutely right. Anybody that can bill Medicare or insurance companies, they are considered non-physician providers. Now, the problem with that, it's either you want to focus your practice, your business for physicians or non-physicians, because if you're doing non-physicians, it's more of a volume game. You have to have a lot of non-physicians so that you're making good amount of money. And what I did, I built up almost like 20 non-physicians throughout maybe 10, 12 practices. And then I was able to sell those accounts to other people, to other licensees or medical billers that focused on that area. The nice part about that is that it's easy, like let's say, for example, a mental health counselor, they either do initial exam and then they do 45-minute psychotherapy session. So all you have to do is to know those two codes and just click, and basically the insurances that do pay for mental health, they're pretty standard. You got the United Behavioral Health, Blue Cross Blue Shield. So whenever you bill them, they're going to pay. You don't have this like wide spectrum of insurance companies, a huge account receivable. So it's very straightforward when it comes to servicing such accounts. For some reason, I just thought that I would like to spend my energy more on consulting, which is basically helping doctors that want to open their own private practice.
Nice.
Started up, right? So that was a little bit more interesting for me. We help them with everything they need with all their paperwork, their licensing, their credentialing, their EMR, and then all the way leading to billing. By the way, we also can service your account forever and ever. So my client list kind of went up at some point, and then it went down because I had to have some other billers take over some of those accounts. And right now we're servicing, I think, 9 accounts, and they're all physicians basically. They range from orthopedic surgery, pain medicine. Pain medicine is amazing, guys. I mean, if anyone gets any kind of pain medicine account, those are my favorite ones. They're a lot of fun to bill.
Do they give you free samples?
Free samples. Right. I wish. No. I mean, it's pretty cool to see what those people go through, because a lot of those doctors, they have to always be on the lookout for people that are seeking treatment, not because they're in pain, just because they want a pill. And just to go on a tangent that really doesn't mean anything, but right now, if you have a script, opioid script here in Illinois, in Chicago, you're allowed to go to a marijuana dispensary and exchange it with like a medical card, just because like there's like this national movement against opioids and anything like that. So yeah, I get to learn all those like cool facts and from my friends doing pain medicine.
Well, I just want to point out, folks, because we're not a franchise, you see, we don't limit you as a licensee. Just like Rene has branched off into consulting to doctors on how to even get their practice profitable and get it started and so forth. That's all up to you. We've had licensees branch out into all sorts of stuff. One guy was a CPA. He said, I'm going to do their taxes as well. I mean, you can offer just about any service to doctors, and they have a need for a lot of different things that they would like to outsource, huh?
No, absolutely. No, you're right. You're right on. I mean, it's such a great point, because your business could be multifaceted. As you grow into this field and you start exploring the different the vast system of healthcare, you'll get to see what interests you more. However, you will never be successful, and you will never understand the healthcare properly if you don't know your billing. If you don't know billing, and you don't understand coding, at least like know a little bit of coding, it's very hard to even remotely understand how our system works. It was the best thing I did. It was the best move, basically, to start in medical billing, focus on that, really get to become an expert in this field. And this is how people want you to do more for them. Like, oh my God, can you do this? Can you do that? And then, yeah, opening practices for other clinicians. Everything else seems very easy compared to making sure that you've got a very good flow of billing. It's a very good point, Patrick. I love that.
Yeah. I had one licensee a few years back. He told me the story of him starting to do the billing for a particular doctor that was fairly new, and then in a couple of weeks, the doctor asked him if he could do his credentialing. Well, this licensee, didn't know anything about credentialing. We don't go into that in detail in the training, of course, but that's just doing the paperwork for different insurance companies so that the doctor can get paid from those insurance companies. So anyway, he came back to us. He told the doctor, well, let me check with my people back at the office, and I'll get back with you and give you a quote on what it would cost you to do your credentialing. He didn't even know what it was, but he called our support department, and we pointed him to the right resources. And now he does that and makes a lot of money for doctors doing the credentialing.
Mm-hmm. Yeah, credentialing is a big business. You can, if you want to do credentialing, you can do just credentialing and be fine. You can operate an entire business doing just credentialing. I mean,
there's a lot of money.
It's important, credentialing, because I think the basis of good billing, there's two very important, three important factors: your knowledge, and all of that is acquired by many of the material that you have access to through the ABS website and through the community with ABS. The second pillar would be, focusing on the front desk. And then the third, I believe, is credentialing. Because if you don't know with who you're credentialing with, what you're credentialing, what your fee schedules are, how much you're supposed to get paid in, out of network, do you need referrals for this one, for that one, HMO, PPO. So all of those, it could become a very big mess and have a huge account receivable if your credentialing is not lined up properly. And my first client, actually, he was telling all his patients that, yeah, I accept United Healthcare and I accept Cigna and whatever, and then we'll be sending those EOBs, and then we'll be sending the claims, and then when we receive the EOBs, which is the explanation of benefits, which basically tells you if a claim got paid or not, and it explains why it did get paid or why it did not get paid. So we'll say, oh, this claim went entirely towards deductible because this is an out-of-network provider. And a lot of cases, the deductible would be very much larger than an in-network provider. So this doctor was losing on all this money thinking that he's in-network, where really he was out-of-network. So then I was able to get his credentialing back up to par, because he had a contract once in the past, and somehow it expired and no one replied to the notices that he was sent, and then his contract just expired and he got kicked out of the network. So just me putting him back in network, we started collecting thousands of dollars from the insurance companies.
Okay, Rene, let's see. Janet wants to know, did you have difficulty persuading managers to use the software? Can you talk a little bit about our platform, iClaim and EMRX, and how hard is it to learn that? And do you have to convince the office managers to even switch?
No, I have a very laid-back approach when it comes to selling anything, either our service or software. Of course, for us, we want to use the software because we know it inside out. We're very comfortable with it. It's a very robust software. The one thing that I always tell people that we have our own medical clinic because my wife is a physician. She's a family practitioner. She actually just graduated 3-4 years ago from residency, and I persuaded her to go into private practice right away. So I tell the different doctors that I go to, they ask me, oh, what kind of EMR do you guys use? And I introduce to them EMRX, and I tell them that we use it ourselves. In my wife's clinic, this is what we use. We have the chance to choose any other EMR out there, but this is just more of a proof that we stand by what we recommend. And one of the things that kind of made this more into assertion, not just like a marketing gimmick, is that when we put this EMR to the test, when we applied for PCMH. So PCMH is patient-centered medical home, and basically they have requirements that go above and beyond meaningful use, which is another set of requirements, which is already a lengthy list of requirements that you have to abide by as a practice. So it's very hard to track a lot of this data manually. So this is why physicians, they want to work with the EMR that's capable of tracking this data automatically as you're doing your notes. We were part of a 12 clinic group in the hospital that we're affiliated with, and all of those clinics, it was a pilot program to be like the first clinics that are PCMH approved in the state. So the consultants that the hospital hired to help us get this PCMH recognition, they had to work with those 12 practices. Of course, every practice had a different EMR. We were told that we were the first one to finish with our accreditation, and we were told that our EMR platform was the best one between all 12 practices as far as reporting went with the PCMH data, and like the ease of use, the interface, how user friendly it was, and how everything was more importantly just accurate. You know, you can double and triple check stuff and cross reference, and everything works out. So it's definitely something I can speak for, how happy we are with the EMR.
Well, and folks, if you haven't been on some of our previous webinars, we're showing screenshots of it here. It runs on any platform, any computer. As long as you have a connection to the internet, you can get to it, right? It's a cloud-based system, so it's not software that resides anywhere except on our servers. And that's the safest way to keep your patient data private too. So,
Yeah.
All right. Let's see. Mohammed says, how many clients can you manage by yourself before hiring and training people?
I see. Well, you know, it depends. It depends on a couple of things that you want to take into account. First of all, is your role going to be servicing accounts, or is your role to grow the company? So many people take the route, and it's not a bad route to take, by the way. Don't get an office space. Don't keep your overhead at a bare minimum, and get 3-4 clients, 5 clients, you know, and service them yourself. And just make that money every month, you know, and you're gonna be fine. Or you take on the role of, you want to grow your business, you want to, you know, you get more accounts, you need to hire more employees. You hire more employees, you say, well, this employee is sitting here, they're not doing much, I need to go get more accounts. So it's like a it's like a cycle. So and that's exciting as well. It's just how much you can handle as far as managing people, because not only do you need to make sure that you're servicing your accounts properly, but you're also managing your employees, and do you want them to mirror you in the same amount of you know, excellent service that you're giving your clients. So I think one person cannot handle more than 3 to 4 accounts full time. You could, but then I think the quality might become a little bit less than what you would want. If someone is running a full-time clinic 5 days a week, and depending on how complex their account is. So for example, I have one account 5 days a week, pain management, all they do is Medicare and Blue Cross Blue Shield. So it's very, very straightforward. It doesn't take as much time as another pain clinic that all they do is worker comp and personal injury. Because worker comp, personal injury, you've got all those hundreds of payers, hundreds of lawyers, negotiations, liens, adjusters to talk to, faxing medical records, you know, not straightforward. So depending on the account that you got, and depending if they're full-time or part-time, that plays a role. Usually, you know, as just like a rule of thumb, one person should not be working on more than 3 to 4 accounts. And by accounts, I mean providers, because sometimes you can get one account that has 2 or 3 providers all at once. Like one of the orthopedic accounts that I have, they have 3 providers. So, yeah.
Yeah, kind of tying in with that whole question, because in people's minds, they find it hard to know, well, how many claims would I have to do to be full-time or part-time, and how much money can I make? So one of the questions here, let's see, from uh, Miriam is about what's the average monthly income and what's the average number of claims that you'd have to have. So I'm just showing our website here, folks, because right here under income potential, we have a little calculator that you can go to, and when you fill in the blanks here on it and push a button, it'll tell you, like if you had one doctor with 20 claims a day, working 5 days a week, and you were making 6%, let's say, of what you collect for them, when you hit the submit button, it'll tell you there's what, $31,200 for that one account. Now you have some costs and overhead, of course, but still that'll give you a feel for how many doctors you could handle, because 20 claims a day is not that many claims, is it? I mean, you could, like you said, handle probably 3 or 4 times that at least.
Right. Yeah. No, 20 claims is not that bad at all. I mean, you can definitely do 60, 80 claims. Yeah, you can do that.
Now, one of the questions was how did you get your first client, and when after you left the training?
Um, you know, it took about 2 months and a half. The first, and it also depends when you start counting, because there's almost a few weeks that you're really not doing much. It was more setting up your corporation, getting to pick a name, logo, printing cards. But then I was just, going from practice to practice, introducing myself. At first, I was more introducing myself more like, I'm Rene. This is what I do, and what kind of EMR do you guys use? Do you use a billing company? This, that, trying to engage conversation. But then I started telling people that, I just want to introduce myself as a business owner. I'm your neighbor. I opened up a business here, and we do medical billing, coding, credentialing. If you guys have any questions or any current difficulties, situations that you're encountering, I'll be more than happy to help or just answer questions, even though we don't have to work together. Even if you just like, hey, Rene, I got a question about this, like I would be fine to just answer that. So people were receptive to that, and just as as a business owner, you've got a little bit more weight because the medical practice, they're also business owners as well. So you're kind of talking on the same level. The one clinic that I went to, they were internal medicine clinic, and the front desk person was a very good friend of the doctor himself. It was a solo practice. And right away he's like, oh yeah, well, we have this medical billing company, and we're fine, everything's fine. So we just started talking about everything and anything, really. It was cold outside and didn't feel like leaving right away. So then I'm like, well, how much do they charge you? And he said 5.5%. And at the time, that's how much that was the customary charge. So I said, look, I'll do it for 5%. And he's like, well, this could be interesting. And actually, we're not really happy with this billing company. I'm like, okay, tell me more. So they're like, well, we have to fax them stuff, and then they fax us stuff back. They don't understand the handwriting of the doctor, and it was all paper charts. The doctor was close to retiring soon, and he refused using an EMR, even though I proposed it to him, many times. But they did not even have a computer inside their office. They would take appointments with an appointment book. They said, well, we had this lady, her name was Betty. She would come in every 2 weeks, and she would do all our billing for us, and she was great. And then she had to move out of state, and now we hired this company, and all of our collections are going down the gutters, and I hate them. And like all of a sudden it became very dramatic. And I said, well, just give me a chance, like I'll be very dedicated to your account, and I can make this work. I can come and pick up your charts, and I'll take them to my office once a week, and then I'll return them for you. This way we don't have to do this whole faxing back and forth. So I just wanted it to work, and I said I'll do it for 5%. And there was this back and forth. I wrote up the contract. It was the first time I write up a contract. I edited the contract. So basically, as part of what you get with the ABS is all those templates. And of course, instead of going to a lawyer to formulate and put together a contract, you get a template of a contract. And the doctor had all those changes. He would like make me do all those like small changes, like, hey, change this word and type it back and come back to me. So I'll have to go home, make like a small change, come back. It was horrible. Like at the beginning, like he really put me through a lot just to get this contract. There was a lot of back and forth. But then when I did get it, we went from collecting $12,000 a month to $35,000 a month.
Wow, what a difference.
Yeah.
I bet they were happy.
He could not believe it. Yeah. He like tripled his income. I saw that he was coding everything wrong. He was spending time with patients and not coding the time spent. He was just coding based on complexity level. He was also doing some minor procedures that he wasn't coding for. He's the one that had his credentialing all tangled up, so I was able to work with insurance companies taking care of that. And then putting him on electronic software, which is the practice management software that we work with. Everything was much more streamlined. So one thing that I think he appreciated a lot, and this is when it was such a big switch in my career, I was able to get him close to like $85,000, $90,000 from Medicare and Blue Cross Blue Shield and all those other insurance companies, because there's a timely filing of 1 year with Medicare and Blue Cross, where you can go back in time and fix claims and resubmit them. And we did that, all of his claims that were submitted incorrectly, and we just collected this huge amount for him, and he was very, very happy with that. So
I can imagine. Yeah. Hey, Rene, I'm sorry.
Sorry?
I'm sorry. I'm sorry to cut you off, and I love the fact that you're giving real good, meaty information here, but we only have about 10 minutes left. I was just wondering, maybe, because we got a lot of questions here, so if I could just ask the question and maybe you could address the question, and then let me move to the next one. We'll try to get as many in as we can.
Let's do it. Fire round. All right.
I can tell you you're excited about the business, and that's a good sign, even after 8 years. Okay, so let me address one here that says, do you work from home or office? You're in your office now, is that right?
Right, I'm in my office right now. It's a smaller office. Mm-hmm.
Yeah. So you actually rent space in an office building.
Yes. At first, I worked at home for a year. Then I rented an office, and then I rented bigger offices where I had the employees work in my office. Now I have a smaller office again, but I have employees working remotely for me.
Oh, good. Well, yeah, they can work from anywhere if they have an internet connection. Yep. You just give them their own credentials to log into the system, right? And all right, Kazi says, well, he asked this earlier, and I think you addressed it. When did you get your first client? You said about 2.5 months. Now, that depends on how much time, if you're full-time or part-time. Were you working at full-time at that point?
Yeah, full-time. That was all my energy went into this.
And like you said, you probably took a week or two there to kind of get things up and running. But folks, this is not a get-rich-quick thing. And to have a client that I'm assuming that you made some money off that client for a while at least, it's worth whatever time it takes to get that first client, isn't it? Some people take 30 days, some people take 90, some longer than that.
Mm-hmm. Yep,
Yeah.
absolutely. No, we worked together for a very long time, and actually, we worked together up until he passed away. So
Oh, really? Well, that's one way to lose an account.
I know. So yeah, I mean, he lived a long and full and fulfilling life. He was in his
Good.
90s and still practicing. Uh,
Wow.
so no, he was happy to let go.
Now, do you have clients that you have had this entire time, or do you kind of have a turnover sometimes?
Yeah, there is a turnover. You know, people. I mean, I got one guy who just left the country altogether. There's this other guy that wanted his niece to take over billing because she had wanted to be in. So she had taken courses into billing, and they wanted to give her a shot into doing billing in house. Um, there's different scenarios on the turnaround, especially if like it's accounts that you're handing over to other billing companies. But I do have some doctors that have been with me for all that time, so from year one
Yeah.
up until now.
Oh, that's great. Do you bill for any nurse practitioners? This is from Adrian.
Yeah, actually I do.
Okay.
And it's
Yeah.
only
So,
because well, I used to do more nurse practitioners as they're non-physicians, but the only nurse practitioner that I do bill for right now is the one in my wife's clinic, because I got no choice. I got to bill for my wife's clinic, you know.
right, exactly. Very important that you keep her happy, huh?
Yep.
Let's see. Okay, so it says this is from Quincy. He says, "Do you put yourself out as your own name brand and credentials? Like as MBA, CPC, CMRM, our designation. In other words, I think he's asking, you don't do marketing under American business systems because we're just a training and support company for you."
No, I believe it's all about your name, and honestly, what it comes down to is your reputation also, because you get to be known in the medical community that you're serving, and and your name is your reputation, and this is throughout the years, this is what you need to be careful of, always making sure you're doing your best. And this is how you keep getting referrals from different doctors. So it's definitely your name that you want to put out there.
Yeah. Trudy says, how difficult is it to get a doctor to sign with you? And Miriam says the same thing. How do you sell the account? How difficult is it to talk with a doctor or office manager and get them engaged? You obviously have done a good job of it with 9 clients. And I'm
Well,
assuming those clients are practices, right? I mean, there might be multiple
right,
providers in
right,
some.
right, right. They're like established practices. They have at least medium operations going on. So
Yeah.
um, it's to be truthful. The more you know, and the more time you dedicate into all the knowledge that's available for you through the ABS website and the different webinars and different articles and everything that's already provided to you. All of this stuff is provided to you, but no one is going to make you go and learn it and read it and all that. So like the more time you dedicate into the knowledge, the more you're going to sound credible, the more you're going to actually be credible and make a difference in the practice, and people can see right through you if you know what you're talking about or you don't know what you're talking about. So
Right.
I always, I always thought that educating myself into billing uh, portion through like all the tools that's already provided by ABS was a time well spent, basically.
Yeah.
And I even have webinars up there. Like I have webinars. Other fellow licensees have webinars. They recorded webinars with you, Patrick, where they'll talk about different stuff that you need to know as medical billers before you go out there, and very useful information. And
Yeah.
it becomes
You're talking
it
about,
becomes easy. Yeah.
yeah, you're talking about on our licensee website where you have access to all sorts of training videos and
Right, right, right.
resources.
You have to
Yeah.
be a licensee first, right? Of course. because that's when you're in business. That's when you need to learn this stuff.
Yeah. A lot of questions here about the marketing. You mentioned, of course, having gone out and actually called on some doctors' offices, but folks, I'm going to do something I hardly ever do. I don't know if I've ever done this before. I'm going to give you a quick glance at the actual PowerPoint deck that we use in our training class. And as you can see, we go into marketing in detail. Lots of different methods, about 12 different ways to market to doctors. We go into depth about the tools that we have for you as licensees. And so it's a pretty in-depth training that you get on the marketing side. Remember, that's what we're good at. That's what we know. And that's one of the reasons you signed up with us. I think, Rene, you didn't know what you were doing for that area.
No, it's right. Like, yeah, if they persuaded me to join them, that means they're pretty good. They got the secret sauce.
Yeah, right. Janet wants to know what are the obstacles that you have encountered so far? What is there major obstacles you have had to try to overcome?
Well, it's not something that you can scale very fast. It's all personal relationships. It's one-on-one. You have to really work at it. Like Patrick said, it's not something that's a get rich quick scheme. So you have to build trust. You have to build relationships. But what's nice about it is that it grows in an exponential way, because the referrals that come in are just unbelievable. Doctors really do take other doctors' advice very personal. So like if a fellow doctor tells you, look, you got to talk to Rene, he knows what he's doing, they're not going to ask more questions. They're just going to pick up the phone and call me and say, we have to start working together now. So so the referrals, so at the beginning, you get those challenges because you don't have a big network of people that but once you start working with people and once you prove yourself, and that's when everything starts becoming much easier for you.
Yeah. Let's see. This is from Yvette says, was it easier for you because your family is in the medical field? Now, when you got started, though, your wife had not graduated, and so it really wasn't a.
No, you're right. Yeah, no, she was not. She was a medical student at the time, and basically no one in my family actually is in the medical field. On top of that, no one in my family actually lives in Chicago. So I came from overseas to Chicago, started the business. So I did not have friends or family in Chicago. So it was like you or anyone listening right now in the group going to Japan and starting a new business. So it was a fresh start.
Yeah. Mohammed says, I know ABS will provide ample training, but did you find yourself getting certified as a medical coding specialist with some of the other programs that are out there?
Yeah, after the program that I took actually requires you to have at least 2 years of a field that you worked in the field. It's kind of like those MBAs where they tell you it's better for you to actually work as anything in business, and then you should do your MBA. This way you'll benefit a lot more. So this program is it's a certified physician practice management program where you get to learn all aspects of managing a clinic, from credentialing to coding to billing to licenses and insurances and malpractice and all that stuff. And I took that not too long ago, about like 3 years ago. It was something that I just wanted to add to my education. But it was not something that I needed right off the bat.
Yeah, because all the medical codes are actually built into our platform, and especially if the doctor is using the EMR system on their end, they're actually putting the codes in for you, aren't they? When they.
Oh yeah. You expect them to. You want them to do that. You don't want to be doing coding for them, unless, of course, you're getting paid to do coding for them. Most doctors they use the technology that's out there. The coding comes in only if it's like complicated, neurosurgery, orthopedic surgery, stuff that went wrong during the the procedure. So that's when you need the coding aspect, which of course is also something that we could provide. So that's a very good tool.
Yeah, because we actually have certified coders, of course, that the licensees can utilize to engage with the doctor, and of course, for a fee, get all the help that they need from the coding side.
Mm-hmm.
Rene, it's right at the top of the hour. I'm going to ask you, just because you're such a nice guy, if I could I'm going to cut off the questions, but I'd like to ask the few that are left that are specifically to you. Is that all right?
Of course, of course.
Because we just tremendous interest here in what you're saying from these folks that are looking at this. Trudy says, do you charge when you sign a doctor up, and how much do you charge per client? Do you have any kind of setup fees?
Mm-hmm. Yeah, at the beginning I used to charge $1,200, and then I started doing $1,500.
Yeah. And doctors are used to that when they start anything new.
Yeah, I mean, they understand that really, and I explained to them why they're paying this fee. It's not just because, it's just because a lot goes into setting up their account, to start the revenue cycle management. The revenue cycle, it takes a little bit of time. So basically, you need to get compensated for the time that you're putting in to start them off. Sure. And they understand that, $1,500 should not be a problem for a doctor that's opening that has a private practice of business. And if it is a problem, then it's probably not the doctor that you want to be working with. So
yeah, that's a good way to look at it. Although I have had licensees, and I've seen the contracts that they send in to us, that they've gotten $2,500 to $5,000, depending on what services they're going to offer to the doctor, of course.
Right. Yeah, I mean, you can charge whatever you want. The reason why I don't like to stretch it out too much is because you're going to eventually make money over and over every month. So,
Yeah, you have to look at the long-term revenue from that doctor. Yeah. Right. Claude says when you wore scrubs into the doctor's offices, how do they react when they realize that you weren't part of the medical profession? Well, you are.
Well, I am. Yeah.
Yeah. I guess he realizes that you're not a doctor or a nurse, but hey, there's nothing that says you have to be a doctor or nurse to wear scrubs. They're very comfortable.
If you go to any hospital, so if you go to the emergency room, ask for the biller, or if you go to the OB room, the OB floor, deliveries, for example, there's always going to be a biller there on the floor, making sure like all the charges are captured. And the billers, they're all in scrubs. That's
just the way they dress. Yeah. Mm-hmm. Okay, this is from Yvette. Says, what type of questions did you find yourself asking in order to know how to help your clients?
Well, I mean, I can give it a shot at this. Basically, you want to do a quick calculation in your head to see if they're collecting what they're supposed to be collecting. So it's more of a like mathematical formula. Are you seeing more commercial people versus Medicare versus public aid? How many patients per day? How many days per week? Then you say, well, you're seeing 10 patients per day. You're doing a lot of procedures. That should be like about $200 each claim. That's $2,000 per day. That's $10,000 per week, $40,000 per month. You should be collecting $40,000. How much are you collecting? And then they say, well, we're only collecting 20. So like, oh dear, we need to look at your your situation.
Something's wrong here. Yeah.
Right. Yeah. So if you want to get right to the meat of it, I mean, this is really what we want to know.
Yeah. Rene, some of the questions left are kind of generic questions. I'm going to turn it over to Eric and let him kind of close out. But thank you so much for your time. I appreciate you being on this today.
No, I always enjoy it. I'm glad to help, and good luck to everybody that's seriously pursuing this business.
Thank you very much. Hey, I know that you're probably busy, but every once in a while you take calls from people. If we give out, we're not going to give your number out, but we'll give them back to their business coaches here. And if they want to call you and talk with you, is that okay?
Yeah, absolutely. I'll take any other questions or more specific questions or any kind of just direction, whatever. I'm up for it, of course.
All right. Thank you, Rene. Bye for now.
All right. Have a nice day. Bye.